The key messages for my chapter are that of prudent public health begins with prevention. Within the NHS, we're facing inexorable demand. We must refocus on both our policies and our resources in terms of investing in prevention in order to stand a chance of stemming this demand. The second thing it focuses on is the reduction of health inequalities. We know in Wales we face large health inequalities. There's an 18-year gap in healthy life expectancy when you compare people living in the most well-off areas of our communities in comparison to our least well-off communities. What does that mean? That means that if you live in our most deprived communities, you will die earlier, but also you will live with long-term conditions for a greater length of time as well, which impacts on your quality of life. The third thing that is important is that we need to focus on what works. We need to work with the evidence in terms of effectiveness and cost effectiveness, and to be brave enough to actually take decisions in terms of both investment based on health outcomes, but disinvestment in things that we know just don't work. If we invest more in health promotion and disease prevention, we know, and in terms of reducing health inequalities, we know that we will potentially reduce the demand on the NHS, particularly in relation to older people living with longer term conditions, that we need to actually focus on what matters in relation to diet, obesity levels, levels of physical activity, alcohol consumption and smoking. These are the big ticket issues that if we focus on them, we will upstream actually be able to prevent the impact of these things on diseases like cardiovascular and cancers. In order that we implement prudent public health effectively, it's absolutely essential that we work with our communities in partnership. We need to develop joint plans, working with the skills and expertise that we know is within our populations and within our local communities, in order that they can be delivered to be tailored to the benefit of those communities. If we get prudent public health right, what we know is that there are not only savings for the NHS, but there are savings across the whole of the economy, across the whole of society for Wales.